Hi, my name is Jonathan Resnick, and I'll be talking today about managing your electronic DMF submission. I work at FDA in Cedar within the Office of Business Informatics. So the agenda of today's presentation will cover electronic submission requirements, some helpful information on eCTD guidance, talking about what's new, what you should be aware of, submission metrics relating to drug master files, some best practices, some frequently asked questions that our eSub team gets, and then finally some information on where to go for support. So we start with the electronic submission requirement. Industry must follow FDA guidance when submitting a DMF, and this is laid out in what we call the eCTD Guidance. Its formal name is Providing Regulatory Submissions in Electronic Format, Certain Human Pharmaceutical Product Applications and Related Submissions Using eCTD Specifications. This is what's known as a 745A guidance, which means it's binding. The two key requirements stated in the guidance is, number one, submissions to a DMF must be in eCTD format, and number two, submissions sized 10 gigabytes or less must be submitted through the FDA Electronic Submission Gateway. Some of you may know the FDA Gateway more as WebTrader, which is a web-based tool you can use to submit through there. But that's what you need to do if your submission is 10 gigabytes or less. If the submission does not follow the requirements, then it will not be accepted. And a note here at the bottom is Type 3 master files are now exempt from the eCTD requirement. Some supporting materials related to guidance for eCTD. In addition to a hyperlink here to the latest version, revision 7 of the guidance, we also have a link to the eCTD Technical Conformance Guide, which is a nice high-level overview of how to organize your eCTD submission. We also have a link to the eCTD Submission Standards. This is a document which contains all the related specifications and associated documents related to an eCTD submission, as well as a link to our eCTD website. This is a page on fda.gov, and it's really the one-stop shop which gives you access to all the eCTD related materials, and it's also a place where we'll put notices up about anything that's changing or upcoming that we want industry to know about. And then finally, if you have any questions about eCTD, please feel free to contact us at our esub@fda.hhs.gov website. So as I had said, we're on revision 7 in our eCTD guidance, and this revision 7 occurred in 2020, and I wanted to highlight 3 key areas for you. The first one is section 3C, which is a section that covers the types of submissions that are exempted from the guidance. And the item of note here is type 3 drug master files are exempt from the eCTD guidance. So we would still love to get the type 3 DMFs in eCTD format, but you are not required to follow that. So you can submit it in non-eCTD format and send it to us. We do ask that you submit it electronically and not in paper, if at all possible. Section 3D talks about submissions that may qualify for a long-term waiver from the eCTD requirement. Here, it contains waiver criteria for certain PET drug INDs, NDAs, ANDAs, BLAs, and waiver criteria for certain Type 2 drug master files. So I think, particularly relevant for this audience, If you have a type 2 DMF and, for example, maybe it's only being used by a non-commercial IND, then and you don't have the means to submit an eCTD, then this waiver criteria may be of help to you. So definitely want you to know it's there. And then Section 3E, types of submissions that may qualify for a short-term waiver from the eCTD requirement. Here, there's some very specific criteria for what would qualify for such a waiver. And all of these criteria that's here, they all are also paired with how to submit your waiver request and where to submit your waiver request. So it's all laid out there in this guidance. Another guidance note, we're on this subject. There is an old version of eCTD Module 1, which was been in use for a long time. We updated Module 1 back in 2015, and since that time, FDA has been accepting both the newer and older versions of Module 1. But a notice did go out last year in the Federal Register announcing that starting March 1st, 2022, FDA will no longer accept eCTD submissions that are using that old version of Module 1 based on DTD 2.01. And you can take a look at the Federal Register notice. There's a link here for more information if you need it. Here we thought it'd be a good idea to share some metrics specifically about DMF submissions. This is for calendar year 2020. This particular graphic is showing the percentage of all DMFs that came into Cedar that were in eCTD format. So here we see that 85% of the DMFs came in eCTD. These are the type 2s, type 4s, type 5s, some type 3s came in eCTD as well. And then we see that 15% of DMFs did not come in eCTD format. Now here, this is almost all type 3 submissions that make this up. Here we have a slide on showing the DMF submissions in calendar year 2020 by method of delivery. So how did they come in? Did they come in through ESG? Maybe did they come in on physical electronics such as a DVD or a USB drive? Maybe they came in through Cedar's NextGen portal or on paper. And what we find here, not surprisingly, is 85% of the DMF submissions came in through ESG. And these are all basically eCTD submissions that came in. And there could be a couple that were non-eCTD, but most are. What I want to draw your attention to is this area of paper, where 13% of the DMFs came in on paper. These are almost all type 3s, and we really want to get away from the paper submissions, and I'll be talking a little bit more later about opportunities industry has to submit electronically instead of paper, even if their submission is not in eCTD, like a type 3. I've got some best practices here to share. The first one is you can now request a Cedar DMF application number through the Cedar NextGen portal. Very easy, straightforward process. You no longer need to do this through email. We'll get into how you can access this portal and request a number in a few minutes here. The next one for best practice is how to organize the DMF submission so that it follows the ICH Common Technical Document structure. And what we have here are several documents that are hyperlinked to the presentation that'll help you with that. The first is the eCTD Technical Conformance Guide. This is that high-level guide to give you an idea about how to organize the submission. We then go to the Comprehensive Table of Contents, Headings, and Hierarchy, also known as the CTOC. This here is a granular listing of all the standardized eCTD headings and subheadings that are available for you to use. The idea here is by publishing this document, you as the submitter will be able to see all the possible headings, and that would help you determine where your document should go. Then we have the M4 Organization of Common Technical Document for the Registration of Pharmaceuticals for Human Use Guidance for Industry. This is a guidance, really a document that was generated out of the ICH M4 group, which FDA then took and published it as an FDA guidance. It gives a lot of help. There's narrative information here about how to organize information that you're submitting to modules 2 and 3. And then another document which was created by ICH and put out by FDA is called the CTD, Quality Questions and Answers Location Issues. And here this gets into some really detailed scenarios. So for example, we often will see questions from industry asking whether or not it's okay to create multiple 32P or 32S sections based on their particular scenario that they have. And this document is great because it lists some different types of scenarios and what the thinking is for whether or not you put things under one common heading or whether you separate it out. Then finally, there's a DMF webpage on the FDA.gov website, and it's great for DMF-specific information. There's even information on submission resources, so we encourage you to be familiar and bookmark that website and go to it often to see if there's anything new related to DMF submissions. Getting into some best practices about managing your DMF lifecycle. These are specific eCTD tips. The first one is to, if you're starting a new DMF or maybe you're transitioning one from paper to eCTD, we encourage you to start that eCTD dossier with sequence 0001 and then increment by 1 going forward. Some people we know started with 0000, and that's perfectly fine. Another tip here is when updating a document that you've submitted in a prior sequence, we want you to use the eCTD replace lifecycle operator. The reason for that is when you're sending us a document, and this document is basically a newer version of something you submitted previously, by using the replace lifecycle operator, it enables the eCTD viewing tool that FDA is using to access these submissions. It basically provides an indicator on the document so the reviewer can easily see that, oh, this document is updating something that was previously provided. Also, to remove a document that you may have provided in a previous sequence, you can use the eCTD delete lifecycle operator, and this will remove that document from the view that the reviewer is using in their eCTD reviewing software. And then finally here on this slide, if you're submitting an LOA, which I know is that's a routine practice with drug master files, if you're ever wondering about what eCTD submission type or subtype you should be using when you're just providing an LOA to a DMF, you want to use an amendment. That's the eCTD type you'd use there. Some more best practices relating to transmitting your DMF submission. Once you've published it and have it ready to go, you should submit the DMF in eCTD format, of course, and send it through the ESG. This is a requirement for the Type 2, Type 4, and Type 5 DMFs. However, for the Type 3s, you can submit that in eCTD or non-eCTD, and if you do decide you're going to submit your Type 3 and non-eCTD, please don't submit it in paper. because now you have the option to submit it online through ESG or the Cedar NextGen portal. So here I've pulled back up that graphic from earlier in the presentation, with that method of delivery graphic, highlighting that we're getting 13% of our DMF submissions in paper, and these are the type 3s. So, the message here is, if you're planning to use paper for submission, because, you say, hey, my submission type is not required in eCTD, and so therefore I'm going to submit this in paper. We want you to just think about using ESG or Cedar instead to submit that. We really don't want paper. And probably most of you in industry really don't want to use paper either. So just know that we do have mechanisms available to you to submit non-eCTD electronically through ESG or the NextGen portal. So now we come to some frequently asked questions that our eSub team gets that we thought would be appropriate to share here in this forum. So the first one we get sometimes. It says, can a DMF submitted to Cedar be referenced by a CDER application? And the answer here is no. Cedar and CDER, they are different FDA centers. And so the DMF should be submitted to the same center as the application which references it. Maybe in the future there'll be a time when two different FDA centers store their submission information in the same environment, and so it can be used, but that's not the case today. And so you do need to submit that DMF to the same center as the application that's going to be referencing it. Another question we get is, can a DMF receive a waiver from the eCTD requirement if it's only used by a pet drug or only used to be referenced by a non-commercial IND? And here the answer is possibly. Based on the information in the update to the ECTD guidance, it could be the case. So if that is your situation, and for whatever reason you're finding that you're unable to submit an eCTD, you should check the guidance and see if you fit into that waiver criteria. Another question we get is, how can I see the activity status for my DMF? So we'll get a DMF holder that contacts eSub. He says, I submitted my DMF several months ago, and I want to be able to look online to just confirm that FDA has it and that it's in active status, and how do I do that? So I can tell you that FDA does have a DMF website, fda.gov/DMF, and on that DMF website they have a link to a document that's published quarterly that shows the list of DMFs that have been received and the status, whether they're active or inactive. Another question we get is, does the FDA have a DMF form similar to something like the 356H form that's submitted with an ANDA, NDA, or BLA, or the 1571 form that's submitted with INDs? The answer here is that FDA is currently working to publish a DMF form later this year. I don't have an exact date or an exact month to tell you when it will be. All I can tell you is that I know that FDA has been working on a DMF form, and the intention is to publish it so industry can start using it at some point this year. But currently they're waiting for approvals. The next question here, is it okay to create multiple drug product or drug substance sections? We get this. This might be one of the most common questions we get related to drug master files. And there really is no, one-size-fits-all type answer to this question. It really depends on the individual scenarios that are happening. And so the best we can do here is to refer you to the published guidance that is out there. Specifically, look at the M4 Organization of the Common Technical Document for Registration of Pharmaceuticals for Human Use Guidance for Industry. That gives a good narrative and discussion about it, as well as the CTD Quality Questions and Answers Location issues. I know that has a couple of paragraphs that talk about some scenarios relating to whether or not it makes sense to create multiple 3.2s or 3.2p sections or have the information combined under a single one. So I've talked a bit in my earlier slides about the Cedar NextGen portal, specifically about how this is a way you can submit a non-ECTD type 3 DMF, or this is a way that you can request a DMF application number. So I just want to give you a couple of slides here on the Cedar NextGen portal. It's a cloud-based system. It's enabled transformation in the way Cedar and industry work together. Really talking about, where ESG is a very transactional system. You go in, you upload your folder of files, and you're done. With the Cedar NextGen portal, there's more questions that you fill in. There's more kind of fields to capture standardized data and information so that it can be passed along to FDA and processed automatically. So how do you create a Cedar NextGen portal account? It's a very simple process. It can all be done in the same day. You simply go to the portal, which is edm.fda.gov, as listed here in this slide. There'll be a link underneath the sign-in box where you can sign up. You click on that, and it's going to take you through a series of pages collecting your information, your email address, your name, company you're affiliated with. It'll take you through some email verification steps, and then you'll be done, and you'll be ready to utilize the portal and submit something through it. So once you're registered, if you want to submit a Type 3 non-ECTD submission, you would click on the FDA Alternate Submissions tab there on the portal. And if you wanted to request a DMF application number, you can click on the Pre-Assignment tab there, and it'll lead you through the questions so that you can get an application number assigned. And of course, if you need any help with the Cedar NextGen portal, they have a team, EDM Support, at fda.hhs.gov, listed here on this slide, that you can contact. So here we just want to give you a slide here on all the support information we can think of related to the electronic submission of your DMF. So number one, we have the eSub team. That's great for eCTD or general electronic submission questions. We also have the Cedar NextGen team. Any question related to the Cedar NextGen portal, from how to register, how to submit something through the portal, maybe where to go for some FAQs or training guides. Any questions related to NextGen goes there. The DMF question team, that's where your DMF content specific questions. So if you have a question about, I'm submitting a DMF and I'm wondering, do I really have to submit this particular document? Go to the DMF question team and they'll help you get that sorted out. The ESG team, that's for all your ESG web trader questions, registering, getting an account set up, asking about acknowledgments, all that type of information. And then websites. We got the eCTD website, the DMF website, and the ESG website. So in summary, the takeaways from today's presentation on the area of guidance, I just want you to take away and remember that the eCTD binding guidance was updated in 2020. The key things are that Type 3 DMFs are now exempt from the eCTD requirement, and the waiver criteria to be waived from the eCTD requirement has been added in there. So there's information about what would what would serve as the valid criteria to get that waiver and how to ask for it. And then also the old version of eCTD Module 1 will lose support in March of 2022. In the area of submission metrics, takeaway here, almost 100% of type 2, 4, and 5 DMFs were submitted in eCTD format in 2020. We saw that 13% of DMF submissions overall arrived in paper. These were almost all type 3s. And really, they could have been submitted electronically via ESG or Cedar NextGen portal. And then finally, best practices. We do want you to use the eCTD lifecycle operator of replace to let FDA know you're updating previously provided content, and to please use the Cedar NextGen portal to request a DMF number or to submit a DMF that's not required in eCTD, like a type 3. So that's the end of my presentation for today. Please, if you do have questions, please feel free to type them into the Q&A box. That way they can be addressed during the panel Q&A after the session. And if you come up with questions after the workshop's over, please feel free. If you have questions about the presentation, you can submit them to the eSub email address here. With that, I thank you very much for your time, and I hope that you found this presentation helpful to managing your electronic DMF submissions.